Welcome to this resource on pheochromocytoma. It's a catecholamine-producing tumor. We'll cover some tips and tricks to help you answer questions you might see on exams, and we'll have some practice quizzes at the end. For now, let me welcome you to Artemis Interactive Media. Artemis is your guide to learning resource supplements and content overview for continuing education. This quick timeout is a short study break and we'll cover pheochromocytoma, a catecholamine-producing tumor. But don't worry, if we need a little help, Artemis will arrive to help us out. A pheochromocytoma is a catecholamine-producing tumor, generally of the adrenal medulla. However, these tumors can occur elsewhere in the body, including the chest, abdomen, and the brain. A pheochromocytoma causes an inappropriate fight or flight response, even if the person isn't threatened. To understand the effects of a pheochromocytoma, it's helpful to understand the adrenal medulla, what it does, and how catecholamines affect the body. The adrenal glands have two parts, the adrenal cortex and the adrenal medulla. The adrenal medulla is the inner portion of the adrenal gland, and it secretes catecholamines. These catecholamines include epinephrine and norepinephrine. The autonomic nervous system can be divided into different functions. You have the sympathetic or adrenergic system and the parasympathetic or cholinergic system. And this presentation will focus on a condition that stimulates the sympathetic system. The body activates the fight or flight response when a person is threatened by releasing catecholamines, epinephrine, and norepinephrine. This could be an external threat, an internal threat, or a perceived threat. Catecholamines are responsible for the reactions that occur in the sympathetic or the adrenergic response. Catecholamines react with receptors located on cells throughout the body. This produces the responses of the sympathetic or the adrenergic system. Adrenergic sounds like adrenaline. These responses occur as the body prepares for the fight or flight response. The fight or flight response occurs as a response to a threat. You may see dilated pupils, expanded airway, increased respirations, increased heart rate, increased blood pressure, decreased activity of the urinary system, decreased activity of the GI system, decreased salivation, and increased blood glucose levels. Because the fight or flight response is caused by catecholamine production and the reaction with cell receptors, it makes sense that the symptoms of a pheochromocytoma, which is a catecholamine-producing tumor, include the fight or flight response. Symptoms of pheochromocytomas include hypertension, palpitation, tremors, diaphoresis, heat intolerance, weight loss, and hyperglycemia. This increased blood glucose is needed to provide the body with energy to fight or run away. Understanding that the patient is producing excessive catecholamines resulting in a fight or flight response helps clarify nursing actions and considerations. Monitoring vital signs and watching for tachycardia and hypertension, monitoring for symptoms of hypertensive crisis, which include stroke, myocardial infarction, monitoring serum glucose levels, providing a cool, calm, quiet environment, providing a diet high in calories, vitamins, and minerals necessary to meet the needs of the client in sustained fight or flight, and preparing to administer adrenergic blocking agents. Diagnostic tests for a pheochromocytoma include a 24-hour urine collection for VMA. This is a product of catecholamine metabolism, all of which are elevated in the presence of a pheochromocytoma. So essentially, when you go into fight or flight and your body releases catecholamines, your body will use it, process it, break it down into VMA, and that is evident in your urine. So if you collect 24 hours worth of urine, they can measure the VMA to determine how much catecholamines you produce. Simply put, excess VMA may indicate that excessive catecholamines are being produced and broken down after use, and the analysis of VMA levels in the urine may be used to assess for the presence of a pheochromocytoma or to assess the effectiveness of treatment. Here are 10 key takeaways. The adrenal glands are located on the kidneys. Catecholamines are normally secreted in the adrenal medulla. A pheochromocytoma is a catecholamine-producing tumor. Catecholamines are responsible for the fight or flight response. This is the adrenergic response, also called the sympathetic response. VMA is a product of catecholamine metabolism. A VMA test is usually obtained with a 24-hour urine. An important nursing consideration is monitoring for hypertensive crisis. A client with a pheochromocytoma may require a high-calorie diet, and medication to treat the symptoms of a pheochromocytoma may include adrenergic blockers. Remember, a pheochromocytoma is a catecholamine-producing tumor that causes a sustained fight or flight response. Let's test our knowledge. Pheochromocytomas can be a complicated topic to understand. They affect more than one body system and they have different treatment considerations. The following questions will test your knowledge on the material we covered in this resource. Please answer the following 5 questions to gauge our mastery of this material. And don't worry, Artemis is here to help if we need her. Question 1. Hormones secreted by the adrenal medulla include, select all that apply, glucocorticoids, epinephrine, androgens, aldosterone, and norepinephrine. Well, some of these are from the adrenal medulla, some are from the adrenal cortex. Okay, Artemis, help us out. Let's see. B and E, epinephrine and norepinephrine. Thanks, Artemis. Question 2. Nursing considerations for a patient with a pheochromocytoma include A. Providing a low-calorie diet, B. Providing a cool, calm environment, C. Providing a positive inotropic cardiotonic, or D. Providing a heating blanket. I'm going to say B. Providing a cool, calm environment. Artemis, do we get it right? And Artemis says, yes, it's B. Providing a cool, calm environment. Question 3. Symptoms of the sympathetic autonomic nervous system include A. Fight or flight or adrenergic system, B. Rest and digest, cholinergic system, hypothyroidism, myxedema coma, or none of the above. I'm going to say A. Fight or flight, the adrenergic system. Thanks, Artemis. Question 4. A pheochromocytoma may be caused by A. Thyroid-producing tumor, B. Aldosterone-producing tumor, C. Beta-inhibiting tumor, or D. Catecholamine-producing tumor. I'm going to say D. Catecholamine-producing tumor. Thanks, Artemis. Question 5. Which of the following is true for a test for VMA? A. It requires a 24-hour urine collection. B. It indicates catecholamine metabolism. C. Both A and B are correct. D. None of the above are correct. I'm going to say C. Both A and B are correct. Thanks, Artemis. Thank you for your attention to this resource presented by Artemis Interactive Media. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Pheochromocytoma involve more than this QT covers. For more information on these disorders, please contact your instructor and refer to your textbook. If you found this resource helpful, considering liking and subscribing as well as clicking the notification so you can receive more resources as they're ready.